Hi, I'm Shelby. This is my audience. Okay. Did you know that half of um, the 6 million pregnancies that take place in the United States are unplanned? I saw this on Huffington Post Healthy Living website, and it came to a shock to me. I wanted to take a stance on this issue, and after a lot of research and internal debating, I came to my decision. First, I'm going to tell you about the cost for contraception, and then I'm going to tell you the need for contraception and the pros and cons of allowing insurance to cover this. First, I'll talk about the cost. There are many different types, and according to Huffington Post, the prices are as followed. The pill costs between $10 and $100, depending if you get the generic brand or the more sophisticated brands. You can get the patch or the ring that costs between $45 to $75. And you can get IUDs or implants, which cost between $600 and $1,000, and this is usually because a doctor has to implant them. It is possible to get the pill at a free or reduced cost at places such as Planned Parenthood. However, it could take several weeks to get an appointment in the low economic areas, which are usually the areas that need help with financial needs for this. Next, I'll talk about the need for contraception. According to the Center for Disease Control and Prevention, 62% of women between the ages of 15 and 44 are on some type of contraception. This statistic proves that there is a need, and the counter of this is 38% are not taking contraception. And I think a big part of that is because of a lack of funds. This lack of funds results in unplanned pregnancies, and that's what we're trying to fix. The Center of Disease Control and Prevention also says the pill is mainly chosen by younger crowds. Some school districts only teach the abstinence-only approach. However, this has a higher failure rate than the pill and condom use combined. And this is because abstinence is a choice, and if your choice changes, it's usually due to a change in external factors. And when you are only taught abstinence only, you're not aware of other safe measures that you could be using to protect yourself. Female sterilization is used in the older generation just because that is a permanent choice. According to Planned Parenthood, it costs about $6,000 nationwide, depending on your area and your income levels. There are better cost-effective options, so I'm not suggesting that these two have to be covered by insurance, because my point is to stop unplanned pregnancies, and this group of people are not the ones taking part in the risky behaviors for their personal lives. Finally, I'll talk about some of the positives and negatives of allowing insurance to cover this. The positive is it costs less for insurance companies to cover birth control for people who are taking part in these activities, rather than taking care of the child that is born from the implanted parent. There is a need, so it should be made available to those that need to take part in that. The negative is that this is creating an impression that premarital sex is morally acceptable. However, according to the Center of Disease Control and Prevention, 7 out of 10 teens are already engaging in sex, so it would be smarter just to give them contraception to fix this problem rather than sticking with the abstinence only, because that's obviously not some people's choice. So now that I've told you the cost of contraception, the need for contraception, and the positive and negative sides of that, hopefully you can feel more informed to make your own decisions about it. Personally, I don't like the idea of making this morally acceptable. However, I do think there needs to be better preventative care for those that choose to take part in it. My point is to reduce the number of unplanned pregnancies. So if making contraception more available for teens, then I think that's what we should do. I hope now you feel more informed and empowered to make your own decisions about the topic, and thank you for listening.